welcome to all of you in attendance to Friends Council on Education's program, COVID, Healthcare and Social Justice. If this is your first time attending a Friends Council event, Friends Council is the member organization of the 76 Quaker schools in the United States. And we have attendees from almost all of them in the webinar today. So we're pleased there. I'd like to welcome our two guests. First, Dr. Wayne Frederick, president of Howard University, and also a surgeon. I've had the honor of hearing Dr. Frederick on a number of occasions speak remotely and in person, and we are honored that you are here to help us today understand these important issues. And I'd also like to introduce my colleague, Crissy Cáceres, who's the head of the Brooklyn Friends School, and one of the wonders of this year in a positive way is that despite our geography, I've gotten to know many of my colleagues like Crissy even better this year because we can meet just like that on Zoom. So Crissy, we're honored that you're here as well. And I forgot to mention an important thing about Dr. Frederick. He is a trustee at Sidwell Friends School. So we are all in this community together. We're fortunate to have you. I will see you all in a little bit. Take it away, Crissy.
I'd actually like to begin there by thanking you, Drew, and your entire team at Friends Council for offering us spaces like this where we can engage around topics that are incredibly centered on the values of Quaker education. I'd also like to thank all of the Quaker heads who together felt very strongly, Dr. Frederick, that this was a topic that needed to be front and center because we wanted to be able to help steward our communities who are carrying a lot of different thoughts and feelings about the topic we're discussing today. And lastly, I'd like to thank you. I recognize just how busy you are and the intensity of the things that I'm sure many are asking you questions about. So you making the space for us is something that we consider a true blessing. So welcome.
My pleasure. Thanks for having me. Appreciate it.
So I'd actually like to begin in a personal space. As a Quaker independent school, we've always seen our alumni as family in every sense of the word. They're constantly returning home to visit and share their experiences. Likewise, as a distinguished alum yourself of Howard over a span of several years, having served in different leadership roles at the university and now serving as president, you have experienced Howard from many different angles and perspectives. What does it mean to you to have made Howard an integral part of your life and your life's work?
Yeah, that's a great question. Howard means a lot to me. My relationship with Howard, I like to describe as a great romance, and my ability to pay down the debt of gratitude that I owe this great institution is why I'm here. This is more vocation than it is a job, to be quite honest. The experience that I had at Howard, the self-actualization that I experienced, and the launching pad that Howard was for my career and in many ways my life were amazing. I have sickle cell anemia, and that was a big draw for me to come to Howard because of their sickle cell center. And in many ways, learning about my disease, how to manage it, led me on a healthier and very productive life. And then the skills and knowledge I got in the classroom and in the halls of the hospital were ones that have allowed me to impact others' lives. And there's no more humbling profession, in my opinion, than being a physician and being able to give back or being able to teach and give back in that manner. So I'm just trying to pay down a debt of gratitude that I know that I would never be able to pay down, but it's worth a try.
Well, first of all, I love that you describe it as a romance because it centers love at the heart of it. And certainly in our Quaker schools, we believe that love is at the heart of being able to honor and respect the light within every single human being. So I really appreciate that. And also there's alignment between what's drawn you to feel that about Howard and how we feel. This is our life's work. It's our life's purpose. And you really speak to that beautifully. So now entering and zoning in on the topic of social justice, specifically as it relates to healthcare, and even more specifically, COVID-19. I have several questions that connect to that. The first, Due to the onslaught on the bodies of Black and Brown people in the United States, there are people who genuinely believe that there's a clear and definitive conspiracy to rid our country of people of color. What do you say to those who see the COVID vaccine as another systemic way to get rid of Brown and Black people?
Yeah, the first thing I'll do is actually not say anything, but to listen to them. I think, unfortunately, what we have been doing for way too long with the concerns of Brown and Black Americans is, trying to speak to them or at them. And I think that we have to speak with them, but that requires listening. We have to listen to what the concerns are. For instance, right now, I know there's a healthy debate taking place across our educational institutions in this country about mandating vaccinations to return to school. The reality is that as a physician, I have taken the vaccine. As somebody with sickle cell and type 1 diabetes, I have taken it for health reasons. As a practicing surgeon, I've taken the vaccine. And I think that we certainly have to ensure that as many Americans, especially those of color, take it, because the people of color in this country are disproportionately impacted by the COVID-19 pandemic. And as we begin to open up our country, they will be particularly vulnerable if they represent a minority of those taking the vaccine. Having said that, the vaccines have been approved under emergency use authorization. And we have to recognize that to mandate a vaccine that has been approved under emergency use authorization, despite my belief in its science and despite my taking it and having my family take it, I think we have to give space to Brown and Black people's concerns. And the best way for us to do is to listen first, and then to educate them about what is different about today. Why can't certain things happen in our medical system today? What are the protections that have been put in place? Explain that while Operation Warp Speed was an unfortunate for this activity, that we must recognize that how we got here was still done in a safe manner, and that we have to assure people that despite the unfortunate name, etc., these vaccines are safe, and the way that they came about are pretty safe.
First of all, I really want to thank you because you centered listening, and listening assumes a relationship. It assumes that you actually care about the other perspective in front of you. And in our Quaker context, that's a central part of our tenets, that we make space, we center ourselves in silence, we allow for those diversity of perspectives to be shared in the same space. When you consider the emergency status, the language used to describe the effort, and you encapsulate that in the context of science, for those that may be wanting to understand that science a little bit more, how would you describe it in a way that feels accessible to community members?
Yeah, sure. What I would say to people is the following. A lot of the research that went in to developing the vaccine has been ongoing for years. And what happened is we stumbled upon an opportunity that has provided us an opportunity to put that research to use. And now that we've been able to do that, I think what that has afforded us is an opportunity to bring these vaccines along based on years of research and not just a short period of time because of the opportunity the pandemic presented. The second thing that I would do, because I'm sure in listening, you will hear about things like Tuskegee, etc. My observation as well is that the average American citizen, Black, brown, or white, Asian American, you name it, cannot necessarily articulate to you what happened at Tuskegee. And I think that's an unfortunate part of the American fabric, where we have these major events that have occurred in our history, and they all come with a headline, and unfortunately we skip the details. It's an opportunity to be transparent, to talk about it, to acknowledge the pain and suffering that it caused, but at the same time to also acknowledge the changes that came about and why today it is virtually impossible because of levels of scrutiny and regulations and oversight that we have that prevent those things from happening. And I think the third thing is to really give people information about the pandemic. The reality is that 98 point something percent of people who contract this virus are not going to get sick or die. That's a reality. However, does that mean that it's okay to take those chances? And the reality of that is no. And that's because vulnerable populations are at risk. And we must explain that to people clearly. We must also explain to people that the utilization of resources that caring for very ill patients has taken up means that other people are suffering as a result. And I see that in my practice. I operate a couple times a month on patients with GI cancers. And unfortunately, for the past 6 months, I've operated on patients with very advanced disease who, in my opinion, may have presented earlier had it not been for the pandemic and avoiding going to the hospital, or for that matter, having our healthcare system really shut down a lot of its ambulatory care services in lieu of the emergency that the pandemic brought upon us. And so there are lots of reasons to, have people rethink what's good for everybody. And the last thing is the interconnectedness. I hope that what people recognize is the interconnectedness of all of our health when you put it together, and why taking a vaccine is not just about you, but it's about your loved ones, it's about your community. And I hope the pandemic, if nothing, has made it very clear to everybody how dependent we are on each other. Everybody from the grocery store person to the delivery person. I think we've had a clear sense of how interconnected our community is.
Such a thorough response, not that I doubted it, but you've touched on so many different points. So I'd love to dissect that a little bit. You spoke to some of the discriminatory practices like the Tuskegee experiment. There's also the sterilization of Puerto Rican women, forced sterilization. You've also spoken about what is known and not known, similar to what happens when you only tell one narrative. And yet we are educators. Right? You lead an HBCU, you're a doctor, you're an educator, you're a Black man here in America. And so you understand that there are multiple layers around that communication and distillment of information. So when you consider those most in positions of power to influence this discourse, to open it up, to educate, how do you ensure that those who do not have an intimate knowledge of the impact of these discriminatory practices can understand those layers so that they can then educate our communities and alleviate the fear by so many community members of color around health practices, including COVID?
Well, I think there are two things that we must think of. One is trusted messengers. Howard University is a trusted messenger, and we saw that in the middle of this pandemic. We were out in Ward 7 and 8, that's where it's 95% African American population, standing up a testing site. Subsequently, we've stood up a vaccination center. We've provided over 30,000 vaccinations over this period of time. And so clearly the community has responded and reacted to Howard being a trusted messenger. I think you have to leverage trusted messengers in those communities. And that's something that we have to do. And the second thing that we have to do a better job of, not just in our public health system, but in general, is making sure that from a civics point of view, we are using peers more so to transmit messages, right? At the end of the day, regardless of my skin color and my background, my chronic health illnesses, people will still be skeptical about me because I am part of the medical community. And I recognize that. However, they will trust their church leaders. They will trust their teachers, their headmasters, like yourself. And I think that that's important for us to recognize, that people in the community are going to use and believe in different trusted messengers, and it's our responsibility to find out who those trusted messengers are, sorry, and to empower them, to educate them about it, to again be transparent to them about what the potential problems are, and to make sure that they can be as articulate and as engaged with their community.
So first of all, this notion of trusted messengers and leveraging those trusted messengers feels like such an incredible piece that all of us can align with, right? We understand the value of partnership. We understand the value of co-conspirator action. We understand what it means to be an action change agent, to utilize our community resources. And I think about the centering of young people in that. In what ways have you seen young people in this current time serve as trusted messengers with one another? Because part of what you've spoken about is that vaccination is also about protecting our loved ones and really engaging around collective health for everyone. What are some of the examples of positive developments that you have seen? I've read so many stories, including the doctors in Philadelphia who forged a partnership, right, to make sure that communities of color or having a high number of people of color were vaccinated. What are other examples that you have been witness to?
So at Howard University, our vaccination center is manned by volunteers in our health sciences system. So on any given day, like on Saturday, this past Saturday, when I went by there, we had a vaccination effort all day. The goal was to vaccinate about 950 people. We hit that number on the button. But the people who were providing the vaccines were medical students, nursing students, pharmacy students were assisting with drawing up the vaccine, and dentistry students were also giving the vaccine. We've had an opportunity to vaccinate a 103-year-old African-American woman. And I think her seeing that full circle, she was born around the time of the previous pandemic. And for her to now be vaccinated by a 20-year-old nursing student brings that full circle. When she goes back into her community, she's a different kind of trusted messenger. Her seniority gives her the trust, but then her taking that vaccine for somebody who looks like her, who would not have been in a position to provide her with that vaccine back in 1919, says a lot, about where we are. And so and then that's an example, one example. Another example is my 16-year-old son, who has sickle cell trait, and we agreed to have him vaccinated as this opened up. And listening to him, talk about it, his willingness, his understanding of it, and also his understanding of the fact that while he may contract coronavirus and not get as sick as someone else, preventing his grandparents who are actually now with us because of health reasons, health issues that they've developed over the past few months. I mean, he is happy to be able to protect them. And so I think that, there are many stories like that that we have to amplify. And as we amplify those stories, I think we give voice to reason, and reason that will bring people to getting vaccinated.
First of all, thank you for bringing up your 16-year-old son. Because what you have done is just show the simplicity involved in what it means to lift someone's true experience and the power that can have, and the influence, and the ways in which, if we look for it and we pay attention, we can see these things modeled by so many. And I also consider that in light of great social impact work or civic engagement. And healthcare is one of those areas where you can be so deeply invested. So as you think about the overall healthcare inequities that have existed in the United States and have received more attention in recent contemporary times, how do you feel that this inequity has compounded over the course of the pandemic? And in what ways do you believe that we can see a shift in that narrative in the coming months?
The social determinants of health are clear: access to physicians, access to healthy food, access to a safe place to live, access to a good job, which would allow you an income and so on. And especially in our country, employment is so tied to health insurance coverage. That's a critical aspect as well. And the reality is that those things have existed with great inequities for some time. They certainly have been exposed during the pandemic. And here at Howard University, we've been on a caravan towards social justice for 154 years. Over the course of the pandemic, many have joined that caravan, and we're thankful for them joining. The reality is, though, as they've joined, we have to be sure that they put more gas in the tank, that they help change the tires, that they give us new headlights, probably a new engine, because they will be distracted again and leave the caravan. But this time, when they leave the caravan, what we hope is that they also leave with an amplification of our humanity, an amplification of the humanity of those who are otherwise been significantly affected by these disparities. And what that will help do over time is to ensure that not only do we decrease the impact of these inequities, but we also bring light to the solutions. We know they exist. People can continue to talk about their existence, and that just simply isn't good enough. What we have to double down on are solutions to their existence. And that includes thinking very differently about how we provide healthcare. One example of that is we need to start bringing healthcare to people rather than having them come to it. My nutrition science students are in Ward 7 and 8, where there's a food desert, helping shoppers shop for healthy choices, helping corner stores put things on shelves in a different configuration that would allow for citizens to be able to have better choices. And that's the kind of work that must be done in order to close these disparities.
Dr. Frederick, this reminds me, I grew up in Newark, New Jersey, and went to public schools in Newark. And there was such a discourse around the fact that literacy, that we as children of color just were not achieving to the same extent as our white counterparts. And really the fundamental problem was that we didn't have access to the libraries, that we didn't have the same access to just literature. And I recall walking to places and centers that would bring the books to us. And I became a voracious reader. And all the while that shifted my own consciousness around my capacity. It isn't that I can't, it isn't that I didn't, it's that I didn't have access. And so you're speaking to the difference in framing, how we frame a situation and what we identify as the challenge at hand. So as you think about the intersectionality of economics, which impacts access so much, what do you believe are the cornerstone points of focus around economic inequities and its intersection with health and healthcare in America?
Yeah, great question. And for me, my bias is going to be reflected here, but education is still the economic escalator of our time. There's no doubt about it. There's no getting around it. We can talk about certifications, we can talk about equipping people with skill sets. I think we have to be very careful in this country that we don't set a ceiling on success for people of color, that we still have to appreciate and recognize that the earning power of people with a college education, with advanced degrees, is still multiples of what it is if you don't finish high school, or even if you do finish high school. That's still a reality in our country, and we cannot lose sight of that. Education is still the economic escalator. And so what we have to do is to make sure that that escalator is moving more quickly, that it has more steps, and that we can put more people on it in a more efficient fashion. And that when we do, they don't get stuck somewhere in the middle, it doesn't break down, but that we are empowering people in the best way possible where they are. And I think if we do that, we will get there. And listen, there's data that is just absolutely terrifying. In 1978, there were more African-American males who applied to medical school than in 2015. We have a crisis in our country, and if we don't recognize that, the health equities are tied to that. It's a fact. If you have less Black doctors, you are going to have worse outcome for Black patients because cultural competence is not integrated into a curriculum quite yet the way it needs to be to afford those patients a better outcome. African American women who are college educated are far more likely to die in pregnancy than their white counterparts. All of those are issues within our system that have to be addressed by a change in how we educate, as well as who we educate. And we have to be willing to make those shifts.
There's so much I just want to shout out and say, yes. Part of what, speaking of data tells a lot depending upon how much that data attempted to get a cross section, right? In order to get representative data. And one of the recent data points that I read is that as a result of COVID, remote instruction, inequities, access, we have 20% less young people of color entering into higher education for this coming year than has been true when you average out the last 5 years. And to your point, that's tragic when you think about the cumulative impact of that over time, because we're talking about generationally shifting and growing the capacity of people of color to influence their children's lives and so on. So as you think about that, what do you believe is the call to action around that so that we do not continue to increase or duplicate that statistic as we navigate beyond this coming year?
So there are a few things here, higher education experienced a 3.4% drop in enrollment last year. Howard experienced a 17% increase. Year over year, we just experienced a 30% increase in applications. Our med school experienced a 30% increase in applications to 11,000 plus for 125 spots. My point being that the demand for a higher education is there. What is in short supply is a supply in terms of access, in terms of making sure that we are giving students an opportunity. And I know that there's a lot of talk about free community college and those aspects. I think because HBCUs, for instance, disproportionately put out larger numbers of African-American graduates, I think consideration has to be given to making access to HBCUs more affordable, despite the fact that we already charge less, but students clearly have an affinity and they want to get there. I think our K through 12 process is one that we need to look at very carefully in terms of the have and have nots and making sure that we're equipping students with the power. We have a middle school on our campus that's focused on math and science. And those students who come to us come by lottery. So they don't necessarily have an affinity or proclivity for math and science. But if you stop them at the bus stop and ask them where they go to school, they'll tell you, I go to Howard University. That assimilation process, being on our campus and going into our different schools and colleges, means that 95% of them, when they finally graduate from high school, choose to go to college. 60% of them choose STEM disciplines. So clearly that early exposure is another key element of what we must do in our system and how we must build that opportunity. And then the last part of that is our educators. We need more educators who look like the students of the future. We have a population that's changing, and we have not yet, I think, reacted appropriately to the pipeline that will reflect that. Now, I have to say, this is an opportunity for me to, praise Headmaster Garmon, head of school Garmon at Sidwell Friends, who, really engaged me pretty aggressively around coming up with a partnership with Howard to expose his teachers and students and my students actually to the opportunity to educate and be there. And we hope that would be a significant fruit, but I think it's that type of bold action that's necessary to move these needles.
So first of all, I'm glad you lifted Brian, because I agree with you. There are leaders right now that are making every effort to centralize these topics and to say we need to call bold action to all of these pieces, because our independent schools, our Quaker independent schools, our landscape is not that of our HBCUs, right? And there is a deep commitment on the part of our schools to make sure that our students are fully seen and heard and loved and appreciated. And the fact is that not every school has the layers of diversity that are most optimal for that level of deep engagement around these issues. The other piece, and I'll get to the question, is that you lifted the impact of bias and the need for culturally competent educators and what it means to instill that in our educational process. Could you speak to the way in which Howard, as an HBCU, is engaging that work such that we as independent schools who don't get to have you on our board, lucky Brian, and have that partnership close, can still benefit from those examples?
Yeah, sure. You know, my School of Education, for instance, has a couple of agreements, for instance, with Prince George's County School District, in which we actually have a teacher education program where teachers who are interested in becoming superintendents and so on, we bring them into our system and educate them. And part of what they get is an immersion around that cultural competency. We think that that's a critical aspect of what we offer. So I think there's still a way to partner and to do that even outside of you know, your home area. Obviously, Prince George's County is close by, but it's in Maryland, and we are located here in DC. But we've had that partnership now for quite some time. This summer, we will bring teachers from various schools who can teach AP courses, and you know, give them refresher on the technical aspect of those AP courses. But what they will also get is our cultural competency training around how to deliver an education to a diverse group of students. And we think that that's a critical aspect of, you know, what we offer and what we can afford folks to get. And the last thing I would say is, you know, I'm always amazed when I hear people talk about, you know, Black teachers and things of that nature. Our HBCUs have schools of education with very talented students who would love to be hired. But, you know, as I've said in my New York Times op-ed about hiring, you have to go fish in the pond where the fish are. And if you know where the fish are concentrated, in this case, the salmon of education, then you've got to go to the pond in which they exist. And right now, a lot of them exist at HBCUs, and I just don't see that level of focus from independent schools on trying to recruit those students. In the same way, I don't necessarily see guidance counselors at independent schools encouraging those high-performing students to attend HBCUs. And I think that that's misguided. And I think a lot of times people just don't have the data. And if they did, they would think about it differently. The number one supplier of African Americans to Harvard's MBA program was Harvard undergrad over the past 55 years, and the number two was Howard University. So again, if you're telling a student who wants to, you know, have a Harvard MBA, the best place to go, you send them to Howard. Howard sends more African Americans to medical school. If you have a pre-med student who's African American, you don't talk to that student about going to Howard. You're doing that student a disservice, in my humble opinion.
So first of all, your humble opinion is a beautiful one, because what you're doing is you're asking us to reckon with ourselves. You're asking us to really investigate what we say we do and who we say we are. You're asking us to consider how we're acting on those beautiful words in our mission. You're saying, listen, independent schools, you're naming this as a core principle of your communities. In what ways is that showing itself by virtue of the points of connection, by virtue of, to your point, the metaphor of you go to the pond where the fish are? And there's a very interesting dichotomy of what it means for people to come to you, right? To heed the call to come to you. And so I really appreciate that you are calling us to reflect upon our own actions and consider living differently around who we say we are when it comes to certain things like hiring. So as we think about our students, since you have so beautifully put them at the center, what should we be teaching our students about healthcare inequity? And if I could expand, so often our students of color experience stories where they are often the victim, where they are not lifted as the brilliant, capable, strong beings that they are. And there is an impact to their psyche. And so when you consider what they should know, what should they know that lifts that brilliance and allows them to see themselves as change agents rather than victims to the experience?
Yeah, that's a great question. You know, I have a 14-year-old daughter who's at Sunwell Friends for the sake of full transparency. And I often tell Brian, I think she's an activist and an attorney all wrapped up in one. Having said that, I think this is fairly simple, and I hate to simplify it this much, but it's about instilling confidence. There is nothing like giving a young person confidence. When you instill confidence in a young person, the possibilities are immense. And that is what I think a lot of students who end up coming to Howard get from us. When people ask us, well, what's your secret sauce? Why are Black students who come to Howard so much more successful in the higher ed system and elsewhere? And I tell people that when they get a D at Howard, they knew they got a D because they didn't do the work. There's no, pandering. There's no issue of somebody looking at them any differently. Their self-actualization is about their confidence. And my advice, for those young people in independent schools is to make sure that you are instilling confidence. That means that there have to be tough conversations with their colleagues, because let's face it, a lot of what students get or don't get at an independent school because of a lack of diversity of the student body is because of the conversations they have with their colleagues and their peers. My daughter, is part of that. Something may happen and somebody may say, oh, it's not that big a deal, Kiwi. It's, not everybody hates Black people, or I don't hate Black people. And, as I said earlier on, it's about listening. It's about recognizing that while your experience might be different, it doesn't delegitimize what someone else may be feeling. But you have to instill confidence in children. You can do everything else. And the way you do that, as you stated early on, is that you have to love them. And you have to love them unconditionally. You have to love them and meet them where they are. And you have to amplify their humanity. And that's one thing in this racial equity conversation we have not been doing. That amplification is met with resistance, because sometimes we want a passive acknowledgement of their difference. That's not what is necessary. What is necessary is to amplify their humanity. And you have to do that by amplifying their history and amplifying their ancestry, amplifying, their past, and also giving voice to their future when you do that, to let them recognize and let others around them recognize that they too can succeed.
Mm. So this actually brings me to a question I didn't have in mind to ask you tonight, but you certainly have led me to that place. And that is that currently there's a very divisive and deep discourse in independent schools, where there are families, some educators, some leaders who believe, all of that focus on identity, on issues of race, on cultural competency, on bias, that's just too much. That actually is detracting from the purpose of why we entered into independent schools. And it's causing particular stress on the part of social justice practitioners who find themselves between a rock and a super hard place, that if they do, they are criticized, and if they don't and step aside and allow others, they're criticized. So when you think about this, in light of what you've said is, there cannot be a passive acknowledgement of their identity. We must amplify their humanity. Howard has that ingrained in the context of being an HBCU. What is true of what is innate to Howard that you think we as independent schools could really glean from such that we are amplifying the humanity of our students?
Yeah, it's a great question. I'm actually going to give you an answer that probably doesn't necessarily promote my position. And that's because this is a process for all of us. Howard is exempt from this process. When I started as president, we had one woman dean out of 13 deans, which means that for all of the focus on social justice being our DNA, we had a blind spot. And so I decided that we would have gender balance search committees. Everybody will go to cultural competency training and unconscious bias training, which, as you can see, people up in our. But we did that. And once we did that, what we saw, and I would not interview finalists unless one of the three finalists was a woman. Today, we now have 9 female deans out of 13, and probably will have 14 within the next couple of weeks as we added a school and we just finished a process. The point is, it's a learning curve for all of us. We have to constantly be at it, and diversity may not represent the same thing in every institution, but we have to be willing to look ourselves in the mirror, see what those missing opportunities are, and to grab them. And so my advice is that I think the willingness at Howard is to be open-minded, to look at ourselves critically, and to find where the shortcomings are and to move on. The other thing I would say is that some of the resistance is because the equation is incorrect. And that equation is that if I focus on A, I am going to have to minimize B in order to get the outcome. And that's not what it is. You can do A plus B, and you can get a bigger amplification of everybody's humanity on the tail end of it. So when I left Howard to go to MD Anderson Cancer Center, and had several Jewish faculty members, one day operating with one of them, I posed a question to explain what kosher means to me. And think about that. I had at that point 2 advanced degrees, had finished a general surgery residency, was board certified in general surgery. And the reality is that I never really sat and had somebody explain to me what kosher was. But we make that assumption that we understand an experience because we hear something repeated all the time, or that we've heard the story before, and therefore we make assumptions that it's the same story. It's not. And we should be willing, especially as educators and educated people, to be a bit vulnerable and to pose that question, and to have people, allow people to answer that question, allow people to say, to tell you the story of when they go to their OBGYN or during the delivery, what went wrong, what about it was unpleasant, what about it may have been the inappropriate thing. And I think if we do that, we recognize that we lift up everyone. To some extent, we really get a better understanding, and we become a greater whole, as it were.
Thank you so much. One of the things that, in giving the example of making sure that every finalist round, there was one female, is that you are focusing on measurable impact. You are focusing on an action step that could increase the likelihood of being able to diversify your body of deans. And I can think back to a school that really set out to do this, Abington Friends School, to say no finalist pool will ever be complete without having a candidate of color, right? And we will make sure that that is true, not just to say they are, but to make sure they're of equal strength, caliber, such that we are really working towards a measurable impact. And the other piece that you name is vulnerability. And I like to focus on this a little bit. I believe deeply in the power of vulnerability. As a matter of fact, I've read and taken in more podcasts than I can think of. And yet, as people of color, there can be, for some of us, a concern around where and with who we share that vulnerability, and whether it will be utilized either against or as a sign of weakness, or be less than. And yet we see, especially when we see affinity groups where people feel comforted by point of connectivity, that vulnerability becomes organic and so beautifully and realistically lived. So what would you say to those in our school communities that are having a difficult time understanding why vulnerability sometimes is easier said than done? What are the conditions that show that a community is healthy enough to be able to count on that vulnerability being central?
Yeah, one is, I think, leadership. Leadership has to be willing to be vulnerable. Oftentimes, as leaders, our knee-jerk reaction is to have the answer. And sometimes we just don't have the answer. If anything, we have more questions. But our willingness to pose those questions to others shows that level of vulnerability. But people respect that, because you have to question, well, if a leader has an answer for every single thing, you have to question the scope of that leadership or the authenticity of it. We can't have the answer for every single question. I think the other important thing about the vulnerability really is about safety. We talk a lot about safe spaces, and I often, again, have a slight contrarian view about this. I warn my students that while you may advocate and seek out safe spaces, be very careful that you're not suggesting to people that the spaces you're not seeking out, it's okay for those spaces to be unsafe to you. So we have to be very cautious when we talk about that. And so I often don't talk about safe spaces, because I think everywhere should be safe for all of us. And what we should be working at is making sure that people are willing to have that difficult conversation in spaces that are unfamiliar or uncomfortable. And that in and of itself makes that a safe space. If you can go into the unknown or go into the abyss, as it were, and still have an authentic and genuine conversation. And I think the last part of it is about being our genuine selves. We all bring a uniqueness to the discussion. I think as a Quaker value, it's one of the things that I have come to appreciate, the impact of the individual and the uniqueness of the individual is embraced. It is something that I've always believed in, and it's why I think I have such an affinity to that, and to that concept, that that uniqueness in and of itself makes us all a better whole, And as I was saying just now, I mean, when people try to make this equation so twisted, as a young boy growing up, one of the first things I learned to make was pizza. I had a buddy in my neighborhood who used to make pizza, and I've used that concept a lot, that sometimes we would have limited ingredients. We would have 6 inches worth of ingredients for, a 9-inch pizza, and we would have to figure out how to distribute it. And the reality is, you can bake a pizza, all the slices would be the same size when you divide it up, but you could have inadvertently taken more ingredients and put it on one slice in particular versus the others, right? And then cover it with cheese, and no one would know. People would be like, this pepperoni tastes a little light, where somebody else got all the meat. And so that is really what we're trying to do. We're trying to take the 9 inches of ingredients and distribute them as best we can. You never see a pizza, well, or at least I haven't seen one, where the slices are thicker because of the flour on one part of the pizza and not the other. The slices tend to be about the same size, but the ingredients we lay on top of them is where we have that distributive effect, as it were, and where I think we've got to be vulnerable and be willing to say, I'm not going to, sprinkle the ingredients unevenly. I mean, we've got to be willing to do that.
First of all, I'll never think about a Brooklyn slice the same way again. I'm going to question. Pepperoni is a little lighter on one than the other. So you've given me something to think about. You spoke about Quaker values and the way you've been impacted. First of all, as a parent in a Quaker independent school, as somebody who leads a school in which the values, I would say, have incredible point of connectivity and alignment with Quaker communities. George Fox, who's an important figure in Quakerism, said, let your life speak. In other words, let your actions speak and not just your words. Mm-hmm. With action in mind, how can Quaker schools communities specifically support with dignity and grace those in our community who are holding fear and anxiety around inequities, particularly in healthcare? And how can everyone outside of a Quaker community let action lead the way?
I did not send my daughter to Sidwell because of the Quaker values. I sent her because I thought she would get a great education. However, since she's been there, I have benefited from the Quaker values. And the primary reason is because Brian Garman decided to engage me. We have a policy in my house, because I'm an educator, that I don't get involved. My son is at St. Albans, so parent-teachers meetings, we have a very set way of approaching these things. I sit in there, I'm quiet, my wife asks all the questions, and then at the end, I go have a conversation with her, because I never want any of the educators to feel that I am trying to be a know-it-all because I'm a university president, et cetera. But Brian Garman, just like at St. Albans, they convinced me to get on their board, and they engaged me. And I came to understand what St. Albans was about and to really develop an affinity for it. And then Brian Garman did the same thing. He engaged me. And I think that engagement is what is key for everybody at a Quaker school. I think it's one thing to talk about what your values are. It's another thing to engage people so they live it. So I've had the opportunity to give talks at certain conferences. I've had the opportunity now to sit on the board, to sit on the medical advisory task force, and to actually see how committed and concerned and caring people are. It's one thing to have somebody recite the Quaker values. Is another thing for you to participate and seeing it come to life. So what I would suggest is engaging people, meeting them where they are, having the students and the community at the school engage in those neighborhoods actively, participate in trying to assist people in those neighborhoods, opening up your schools to those young people who may otherwise not have an opportunity to attend there, but could benefit from different types of things, whether it's be free SAT prep or whether it's volunteerism that take the community into those neighborhoods. I think all of those are opportunities that could give, I think, voice to those who have concerns and really live out the Quaker values as I've seen it in my own experience.
Thank you so much. I know that we are at the very end before we turn it over to Drew. I'd like to first and foremost thank you. What you spoke about just now is really reciprocity, that we have to meet each other. We have to actually make space for that engagement and genuine relationship. We have to enter into the unknown, even when we have examples or narratives that make it a little bit anxiety producing for us to do so. And what you're essentially also asking us to do is to model that for leaders, for educators, that we need to model that so that our students can really see themselves engaged as actively by virtue of their own gifts and strengths. So Dr. Frederick, it has been an absolute pleasure to gain from your gifts and your perspectives and your wisdom and your own vulnerability. I really want to thank you on behalf of all Quaker schools around the world. We thank you.
And thanks for having me. I look forward to visiting the Brooklyn Friends School.
I'm going to hold you to it.
You'll have to walk in the neighborhood for a slice of pizza when the visit's over. I just want to express my gratitude to you, Crissy, as a colleague. It was great to hear from you as well, and I look forward to seeing you Thursday. And Dr. Frederick, it's been a pleasure meeting you and hearing from you. I'm sorry we don't have more time, but we will continue to engage, as you say, in the ways that you've described, and we hope this isn't the last time we see you. So thank you again. We're grateful, and have a good evening, everybody, and thanks for coming.